All right, let's dive into something that, well, it probably keeps a lot of us up at night, especially if you're in a regulated industry. We're talking about training compliance. You know, we all chase that perfect 100% complete training record. But what if I told you that perfect record might just be an illusion? So, picture this. You've just finished a big training push. You pull up the report, and there it is, that beautiful, beautiful 100% completion rate. Everyone signed off. Everyone aced the quiz. Feels pretty good, right? But let's pause for a second and ask the really important question. Does that number on a spreadsheet actually mean your people are 100% compliant when they're out there on the floor doing the work? And this leads us right into what I call the paper-perfect illusion. It's this world we've built around checklists, signatures, and quiz scores. And look, it's comforting, it's totally measurable, and for a long, long time, it's been the gold standard. But today, we're going to poke some holes in that standard. Because here's the absolute heart of the issue, plain and simple. A training record doesn't actually prove understanding. I mean, think about it. A signed piece of paper or a check mark in a system, it's a record that an event happened. It's not a guarantee that the knowledge actually stuck. So let's really dig into that for a second. What's really behind that passing score? Is it a deep, functional grasp of the material? Or is it just really good short-term memorization for a multiple-choice test? You know, imagine an operator who gets a perfect score on a quiz about sterile gowning, but then goes and accidentally brushes a glove against a non-sterile surface on their way into the clean room. The record says 100%, reality says you've got a huge contamination risk, and that's where this whole paper-perfect idea starts to fall apart.
So let's talk about our favorite tool for this, the quiz. It's a staple of compliance training everywhere. But what is it not telling you? Turns out, quite a lot.
First of all, passing a quiz does not mean the employee actually understands the step-by-step process. Seriously, they might be able to pick the right answer from a list, but do they know how to do it when they're on the line, things are moving fast, and maybe an alarm is going off? A quiz almost never tests that real-world application.
Second, and this one is so critical, it does not mean the underlying risk is clear to them. An employee might know the rule, but do they genuinely understand the consequences of breaking it? Do they feel the weight of why a certain step is so important for patient safety or for the quality of the product? That's a whole different level of understanding.
And finally, and this is probably the biggest miss of them all, a passing quiz gives you zero guarantee that the correct action is going to be performed consistently every single time without fail. Real compliance isn't about knowing what to do once for a test. It's about doing it right by habit, by instinct, every single day.
Okay, so if quizzes aren't really the answer, then what is? Well, let's look at what the people who really matter, the regulators, like the FDA, are actually looking for. Their test, it's not multiple choice. It happens right there, on the floor, when an auditor walks up to one of your people.
Regulators are looking for this simple but incredibly powerful three-part proof of competence. First, can your employee just explain what they do, in their own words, not just reciting some SOP? Second, can they physically show the auditor how they do a critical task, nice and smooth and correctly? And third, can they tell you why? Do they get the impact of their actions? That's the real test of your training.
And what this all points to is a fundamental shift that we all need to make in how we think about this. The focus has to move away from just documenting that a training happened to observing and confirming actual on-the-job behavior. That is the key.
So we're shifting our focus from the artifacts of training to the actual outcomes. You see, it's not about the records, quizzes, and signatures anymore. It's all about whether your team can explain, show, and, most importantly, understand the why. This is a total change in mindset, from top to bottom.
So the real goal here is to get beyond the training record. That record, it's not the finish line. It should be the starting point. It's the beginning of a conversation about real competence, not the end of it.
If you take just one thing away today, please let it be this. Effective training changes behavior, not just documentation. It's all about what people do when nobody's watching, not what they clicked on in a learning module 6 months ago.
And that leaves us all with one final, pretty critical question to ask ourselves. I want you to really think about your own training programs, your own compliance systems. Do they just create a really nice paper trail, or do they actually prove behavior?